So up next, we have our HIPAA team, and they will be presenting on security, proper safeguards for a compliant HIPAA security program. And Amy Daly will be our presenter. She is an HIT advisor with the Kentucky Regional Extension Center, and she has a bachelor's degree in computer information systems. She has worked in healthcare IT for over 10 years and has been with us at the Kentucky Regional Extension Center for over 6 years. She has supported our promoting interoperability and HIPAA service lines during that time and is certified in healthcare privacy and security. As before with our sessions, please enter your questions in the chat. And if Amy has time at the end of her session, she'll answer them directly, or else we will contact you later on to answer those questions. Take it away, Amy.
All right, Catherine, I have to take myself off of mute in order to do that, right? So can you hear me? Can someone just confirm that they can hear me real quick? Catherine, could you come back on and let me know if you can hear me okay?
Yes, I can hear you fine.
Oh, good. Okay, good, good. All right, well, I'm excited to be presenting our HIPAA portion today. And as we always do, we kind of give you a little slide here to show you the faces of our HIPAA team. And so our team is made up of Brent McCune and Seth Taylor and myself. More than likely, some of you have seen us on site conducting your security risk assessments. So the next slide. Did we already do all of the disclaimers? Good, we got that out of the way. All right, so I can hop right into what we're going to be discussing today for HIPAA. Before we get started into the bulk of the presentation, let's just quickly look at and familiarize ourselves with the HIPAA rules that are out there. And you may not realize it, but technically there are 5 HIPAA rules. We have the privacy rule, and I think that's the one that we're all the most familiar with as we work in healthcare, and it's been around the longest. What the privacy covers, it creates standards for the privacy of our patient health information and the disclosure rules. And then we have the HIPAA Security Rule, which standardizes the handling of electronically protected health information, so our electronic PHI. The breach notification rule, which set about the mandate for alerting any specific compromise to the patient health information. It set out that you've got 60 days to notify HHS of that potential breach. And then we have the omnibus rule. And the omnibus rule brought about the most significant changes to the HIPAA privacy and security rules. And it strengthened the ability of OCR to enforce the rules and levy fines. It expanded the definition of what a business associate is and clarified what parts of the rules pertain to business associates. And it also defined that business associates are required to enter into agreements with their subcontractors, which are business associate subcontractors. And then the enforcement rule. And the enforcement rule came about actually before the omnibus rule, but the enforcement rule contains provisions relating to compliance and investigations, the imposition of civil money penalties for violations of these rules, and the procedures for hearings. Okay, so today I thought I had an objective slide in here, but I'll tell you what, I'll just kind of briefly tell you what I'm hoping to cover today for what the objective of this presentation is really all about. We talk so much about security risk assessments when we do our presentations, and we really focus heavily on security risk assessments. Well, security risk assessments are part of the overall HIPAA security rule, but there's so much more to the security rule. Thank you, Brent. There's more to the HIPAA security rule than just conducting a security risk assessment. And we've never really done a presentation that encompasses the entire rule. And let me tell you, there's a lot to the rule. So what we want to do is we want to identify who does the HIPAA security rule apply to. We're going to talk about the safeguards. You've probably heard us say the word safeguards hundreds of times since working with us at the REC, but that's what the HIPAA security rule is all about, is safeguards. So we're going to literally look at every safeguard from a high level view, and we're going to identify the specifications, the implementation specifications for each safeguard standard. And we're going to talk about required and addressable, because that comes up throughout the entire security rule. Which safeguards are required, which ones are addressable, and what does that really mean? And then we're going to talk a lot about policies and procedures and some best practices for incorporating and updating your policies and procedures. So with that, who does the HIPAA security rule apply to? Definitely covered entities. So covered entities, more than likely most of you who are on this presentation today would be classified as a covered entity. Covered entities are organizations that provide services or products used to provide medical treatment or collect health information about individuals or groups of individuals. So any medical provider, large or small, that electronically transmits personally identifying health information is considered a covered entity. Electronically transmits, okay? So electronic is the key word, and we're all participating in electronic activities these days and transactions. So basically providers, you know, all healthcare providers are covered entities. Hospitals, organizations, healthcare organizations, nursing homes, pharmacies, laboratories, they're all considered covered entities. And every part of the security rule applies to a covered entity. Health plans such as like health insurance companies, HMOs, company health plans, government programs like Medicare, those are also covered entities. And then your healthcare clearinghouses are also most of the time considered covered entities. And clearinghouses are just those entities that are processing your claims, transmitting it between your payer and you. So they're processing. Now, business associates, next, are also subject to the HIPAA security rule. So, you know, you hear us say a lot how everyone, all of you covered entities are required to perform a security risk assessment. Well, your business associates are also subject to the HIPAA security rule, which means that they also must be doing security risk assessment. So just briefly, a business associate is an organization that creates, maintains, receives, or transmits ePHI on your behalf. So on behalf of a covered entity. If they're doing these actions that you could otherwise do for yourself in-house, then they are considered your business associate. And so some examples of business associates, you know, you have like, if you do third-party billing, so you're contracted with a third party to do your billing for you, your coding, maybe it's an accounting firm, an attorney for a healthcare provider, different types of consultants, freelance transcriptionists, shredding companies. Your EHR vendor is considered a business associate. Omnibus rule came in and said, well, there are more types of business associates, such as your e-prescribing services, your backup storage, your cloud storage providers are actually considered your business associates. So the list goes on, and actually this list is not all encompassing. These are just the most commonly utilized resources as business associates. So just pointing out, HIPAA security also applies to your business associates. Okay, so I told you that the difference between this presentation and all the others that we've done in recent years is that we're going to look at the security rule as a whole and all of the many safeguards that are required as part of the HIPAA security rule. So the safeguards can be broken into 3 different categories, and you've probably heard us mention administrative, physical, technical many times, but you probably didn't really realize all that is encompassed under each of these categories. So when you look at this slide, I want you to see that all of these safeguards are considered standards. They're standards, which means they are required. All of these categories, for instance, administrative, a security management process is a required standard under the HIPAA Security Rule. Now, I'm not going to read all of these standards because what we're going to do in this presentation is expand these standards and look at all of the implementation specifications in a nutshell, because it would take far too long to get granular for each of these standards under each of these categories. Administrative standards are administrative actions to manage your security measures that protect your ePHI. And they also are in place to manage the conduct of your workforce in relation to protection of that information. Your physical standards are physical measures to protect your electronic information systems. And these relate to your physical protection measures surrounding your buildings, your equipment, and keeping them protected from natural and environmental hazards and unauthorized intrusion. Technical standards mean technology. So your policies and procedures for its use that protect electronic health information and control access to it will specifically address all of those technical components. So let's look at what is required and addressable, because each of these standards and the safeguards that are associated with each standard are identified by the HIPAA Security Rule as either being required or addressable. So required simply means that the specification must be implemented. There's just no way around it. You have to have something in place addressing that standard or that safeguard. And you have to comply with the required specification. Failure to comply is an automatic failure to comply with the HIPAA Security Rule as a whole. So if you are being audited and you don't have measures in place to address a certain standard, then you would fail the entire audit. Addressable. So we get sometimes confused on what addressable means. And addressable does not mean that they're optional. It doesn't mean that you don't have to implement the specifications for these safeguards. More or less, it means you can either implement the addressable implementation specification as it's written in the rule, or you can implement an equivalent alternative measure, or you can choose not to implement the specification if they're not reasonable and appropriate within your environment. However, if you are going to choose to not implement the specification, then you better have really good documentation supporting your reason to do so, okay? And you would be asked to explain why you don't have specifications around, say, encryption, if you choose not to use encryption. We're going to talk more about encryption. All right, so that's the difference between required and addressable. And throughout the presentation, you're going to see little R's and little A's next to each security safeguard, and that's what those are referring to. All right, a compliant HIPAA security program starts with policies and procedures. And policies and procedures written for your HIPAA security program are required. There's no way around it. You have to have policies specific to the HIPAA security rule, just like you have specific HIPAA privacy policies. So what does the rule say? It says you must adopt policies and procedures to comply with all of the provisions of the security rule. You are supposed to maintain all of your policies and procedures for a minimum of 6 years after the date that it was created or the last effective date, whichever date is later. And then you are required to periodically review and update your policies and procedures. And when we come on site and we perform a security risk assessment, the first thing we ask you for, we actually ask for them before we come, is your policies and procedures. And we ask you how often you're updating those policies and procedures. And when we talk about how long to keep this documentation, it's not just your policies and procedures that you must retain for a minimum of 6 years. It's all of your documentation pertaining to the HIPAA security rule. So for instance, your security risk assessments, your disaster recovery, your contingency plans, your business associate agreements, all of your policies relating to information security and privacy, your sanction policy. So everything that you do documenting your compliance with the security rule, all of that documentation and proof of like all of the evidence that we ask for during a security risk assessment must be kept. All right, so we're going to start with the very first administrative standard. So it's security management process. So it is required that you have a security management process. Now, as we go through each of these standards and subsequent safeguards, what I want you to think about is your policies and what's their current state? What's the current state of your policies? Hopefully you're familiar with them. I think it's a best practice to think about having your policies written to where your standard is the name of your policy. So you would have a HIPAA security policy named HIPAA Security Management Process. And within that policy, you're going to have sections. And those sections are going to correlate with each of these safeguards, which are the implementation specifications for the security management process. So for instance, your security management process policy should have a section for risk analysis. You are required to conduct a security risk analysis, and the HIPAA security rule does not say you must do it annually, but let me tell you, all of the breach reports that I've read point to the fact that if you're not doing it annually, you're going to be in trouble. So there are some things that you just have to read between the lines, and performing your security risk assessment annually is the best practice. Your security management process must include risk management. So you're implementing security measures that are sufficient to reduce your risk and your vulnerabilities to a reasonable and appropriate level. Risk is always going to be there, but you know, how the level of risk is what you're looking at, and a security risk assessment is going to help you identify those. And you want to mitigate those down to a reasonable level, a low level of risk. The security management process also encompasses a sanction policy. So you have to apply appropriate sanctions against your workforce members that fail to comply with the security policies and procedures. Information system activity review. So how do you regularly review? How often are you reviewing records of information system activity like audit logs and access reports? So this safeguard, which is required, says you got to have a policy within your, you know, a section within that security management process that identifies your process for reviewing information system activity. So before I go on, I want to point out, I think the most challenging part of understanding the HIPAA security rule is that when you're reading it and you're going through it, it appears that there's a lot of redundancy. So for instance, information system activity review sounds a whole lot like another safeguard that is in the technical safeguard category, audit controls. So what I want to try to help you do is understand the difference so that you're addressing all of these implementation specifications the way you're supposed to be. So let's go on to the next standard. That is your assigned security responsibility. So you'd be surprised at how many times I show up to do a security risk assessment. And one of the questions I always ask is, who is the HIPAA security official? And the look in the room is one of, I'm not sure. It seems that everyone always knows, every organization is very well aware of who their HIPAA privacy officer is. but not always sure who the HIPAA security officer is, or even if they've designated a security officer, what that role entails. So it's important that you identify a security officer. It can be the same person as your privacy officer. And usually the size of your organization is going to dictate whether or not that role is assigned to the same person as the privacy, that they get all of the fun of the entire HIPAA rules, or if you need to designate a separate person in charge of all that security encompasses. But we really have to nail this one down. We've got to understand. So the rule says you have to identify the security official. Now the rule does not say that it has to be someone different than your privacy. That's just something you're going to have to determine on your own. And then you have to implement policies and procedures around the selection of that role. So those policies, so your assigned security responsibility policy should talk about the qualifications that should exist of your HIPAA security official. And it should also address what that role is responsible for. And at a minimum, that role is responsible for implementing the HIPAA security policies and procedures. So yes, that's the person who should be overseeing the HIPAA policies and procedures. But a HIPAA security officer would also more than likely have responsibilities that would include or delegating. Remember, the officer can delegate, because having them be responsible for the entire security rule and implementing it all on their own is impossible, especially in a large organization. But ultimately, this official is responsible for making sure that a security risk assessment is done and developing the policies and procedures for security, HIPAA security. Regularly reviewing, making sure that audit logs are regularly reviewed, and access policies, implements a security, so the security awareness and training is also a standard we're going to talk about, but the security official should be over that program. She or he can't do it on their own. They're going to have to utilize team members to develop that program, but that's a responsibility. And then making sure that contingency plans are in place and that we're performing evaluations. I mean, everything that's under the HIPAA security rule really falls on the responsibility plate of that security official. So let's make sure we have the right person designated. The next standard is workforce security. All right, so you gotta have a policy in place that addresses the security of your workforce. The implementation specifications, or the safeguards that are identified as being part of this process, is workforce security. Initially, basically, is that you've got all members of your workforce, you're ensuring that they have appropriate access to your ePHI and preventing those workforce members who don't have access or shouldn't have access from obtaining access. All right, so that's required. You have to do it. But what's addressable is kind of how you go about doing it. So you would start with having an authorization and or supervision policy, or the part of this workforce security policy would address authorization and supervision. Authorization and supervision says you have to have a process in place to approve access to ePHI. So it's your process. Now, access comes up in other standards as well. And again, we want to help clarify, what does this part, authorization and supervision, mean as opposed to access management that we're going to talk about later. So just think about authorization supervision as it relates to workforce security clearance and having a process. So you're just detailing the process for how you go about authorizing. Workforce clearance. So you have documented which roles are permitted to have access to ePHI, and you've established a process for which to approve employees So that's your workforce security and your authorization. So now your clearance, you have to determine whether the access is appropriate. And you'll determine if the employees granted access have been approved according to your processes and whether they are in a role which has been determined to warrant access. So you're giving clearance. What are your clearance procedures for designating that role and saying these roles are approved for this level of access? All right. So then when it comes to workforce, we also have to think about termination procedures. So what are your procedures for terminating the access to ePHI when the employment ends? And those procedures should be documented, steps 1, 2, 3, 4. So if you have all of these in place, your workforce clearance procedure, your authorization and supervision procedures, and your termination procedures, then your workforce security policy is tight. You've got what you need. You've satisfied that part of the rule. Okay. The next administrative, and I should have pointed out, the largest category of standards out of administrative, technical, and physical is the administrative group. It encompasses more than 50% of the entire HIPAA security rule. The administrative standards are, again, you know, how it affects our workforce and our security management as a whole. So there's a lot of administrative standards here. Information access management. Okay, so we have our workforce security cleared. We have our procedures in place for knowing who's allowed access and what those access levels are. But now we're going to talk about information access management, so managing their access. The information access management standard says you must have policies and procedures for authorizing access to your ePHI. That's required. And so make sure you document accurate and up-to-date information regarding how ePHI is accessed within your organization. Ensure you include who is authorized access, when and how they are authorized access, and how employees are authorized and cleared for access. Your workforce clearance procedure addresses that. You want to restrict access to only those individuals and entities with the need for access, okay? And you have to determine those persons and or entities that need access to ePHI within the environment to accomplish their task, nothing more. So the minimum necessary rule applies here. When you're giving access, you've got to make sure that that workforce member only has the minimum necessary to fulfill their job. The implementation specifications or the safeguards that should be addressed in this policy, you should have a blurb in there for isolating healthcare clearinghouse function. It is required, but I believe that, you know, clearinghouses know that as a covered entity, that they are subject to the rule. They have technical safeguards in place, making sure that other members of their organization are not accessing your information, because they work for many different organizations and they are usually part of a much larger organization that is doing more functions than just clearinghouse functions. So I think that, you know, you should have a blurb in there for your policy stating that this has been handled and who your clearinghouses are, who you're utilizing, and you'll be able to satisfy that. Access authorization. Okay. So again, this is where it kind of starts to sound a little redundant, but specifically, access authorization is having policies and procedures for granting access to ePHI. So for example, through access to a workstation, a transaction, a program, or another process. So what are your procedures? What are your steps for granting the access, and who specifically is allowed to grant that access? Then your access establishment and modification. You need to have a section in this policy titled Access Establishment and Modification. And this section means that you must implement and manage the creation and modification of access privileges. So how will you not only access or establish the access, but what if the access has to be modified? What are the procedures for going through the steps to get a workforce member's access modified if the need arises? Okay. All right, my favorite section, security awareness and training, is another standard under the administrative group. So the security rule is very clear. You have to have a HIPAA security awareness and training program for all members of your workforce, including management. So don't leave your management out and don't leave your providers out. Your providers are part of your workforce. The standard is that you have a security awareness and training program in place. The implementation specifications and the safeguards that you're supposed to have under this standard come in the form of security reminders. So you should be sending out periodic security updates. You should train your workforce on how to protect from malicious software. We know that breaches are largely caused by clicking on links, opening emails that have suspicious attachments, or clicking on links that are in those emails because they say I have a shipment coming, and then before you know it, your screen goes blue. So how do you detect and guard against those activities? And then login monitoring. So you should make your workforce aware that you will be monitoring login attempts, and that you have procedures for monitoring those attempts and reporting discrepancies. So that should be part of your training program. And then password management, creating, changing, and safeguarding passwords. So within this part of the policy, you should have your procedures written down for how those passwords get created, how often they have to be changed, and how to safeguard them. So they should not be sharing, they should not be writing them down. What does your organization approve as proper safeguards for managing your passwords? Another part of this security training and awareness program, is that it's particularly important that you train your workforce on how to immediately respond to security incidents. So security incidents and reporting those it's another standard that's coming up next, but you have to train your workforce on how to do this. So I would say that when I'm assessing the HIPAA training, when I'm doing a security risk assessment, password management is usually a part of it. Protecting against malware, I do see that, but that's about the extent of what I see in a HIPAA training program. Remember, you have to train your workforce upon new hire, and then best practices, you are providing annual training as well. So you need to fit the HIPAA security training in as part of your annual training. So make sure also that they know how to respond and report security incidents, and that goes back to your HIPAA security official. Ultimately, it may go through chains of command, but ultimately the security official will end up helping investigate and bringing that to a close. So just making sure that you have an all-encompassing training program that points out your HIPAA security policies and procedures, your breach monitoring and notification processes, and then all of these that are on this slide, login monitoring, password management, and making sure that you're regularly reviewing and updating your training as regulations change. All right. So security incident procedures, as I said, this is also an administrative standard. It is required that you have procedures in place for addressing security incidents. And I have to say too, that when I do these security risk assessments, I would say at a minimum, what I see most often is that an organization may have a nice form or a format for reporting, like a template for reporting a security incident. And I usually get a copy of that. But when I ask for examples or history, cases of where they've actually documented security incidents, and how they've reported those and how they were investigated and how those were brought to a close, I really don't get any documentation supporting that. So I really want to point out the importance that this is part of the HIPAA security rule. Now, you know, I know that with privacy, you can have incidents, and it's sometimes hard to understand the difference between a privacy incident and a HIPAA security incident. But you've got to make sure that you have a proper structure for identifying those security incidents and making sure your workforce knows how to report them. Who do they report them to? And then once they're reported, what kind of information is being gathered? And then investigating, how did you investigate it? And then what was the ultimate decision? And then keeping that documentation. Remember, this is also part of the documentation that you're supposed to keep as part of the HIPAA security compliance program for a minimum of 6 years. So response and reporting is a required implementation specification, and just making sure that you know what is required, that you're mitigating, and that you've documented it. So on the next slide, because I think that it's hard to, I get asked this question, well, what would be an example of a HIPAA security incident? What does that look like? So let's just briefly look at these. Theft of passwords that are used to access ePHI. So someone steals another workforce member's passwords, that's a security incident. So that should be reported. Virus attacks that interfere with operations. So anytime it appears that a virus has penetrated your computer system, your workforce should know that they need to report that, and they probably do. They probably call IT and say something crazy is going on with my computer. The IT consultant goes down or analyst goes down, they figure it out, they fix it, and things are back to normal. But was it documented? And you are supposed to document that. Physical break-ins that lead to the theft of media. So a theft of something that is determined to include ePHI. So that's a security incident. Failure to terminate an account of a former employee that is then used by an unauthorized user to access ePHI. Well, that could look like an employee leaves and their access wasn't terminated in a timely fashion, and perhaps that employee gained access while no longer working for the organization. That's a security incident. And then providing media with ePHI, such as a hard drive or a laptop, to another user who's not authorized to access prior to removing the ePHI stored on the media. So you don't want to share computers and devices that have ePHI on them. And if that is the case, it may be a reportable incident. All right. So those are examples of what a HIPAA security incident might look like. Contingency plan. Oh my goodness. Okay. This is probably one of the biggest policies that you're going to write. And I would say that we have a lot of work to do overall as covered entities in understanding really what a contingency plan is and what it should encompass. All right. So let's break this down. A contingency plan is required. No ands, ifs, or buts. You've got to have a HIPAA security contingency plan. The components that make up a proper contingency plan are your data backup plan. This is required. In this section, you're going to describe your procedures for creating and maintaining exact copies of your ePHI. So are you using an EHR that is using cloud-based? Is it a cloud-based EHR and they keep copies? That's great. Where's the redundancy? So understand with your EHR how many types of, or how many instances of backup data they have, and how would you go about working with your EHR to implement that data or access that data if necessary. If your servers are on site, you know, there's a multitude of ways that you can back up data, but just making sure that I outline your process, your procedures for backing up your data. Disaster recovery plan. Okay, I would say that we get this confused with contingency plan, but disaster recovery plan is a component of a contingency plan. Disaster recovery is going to basically the I guess, primary function of a disaster recovery plan is giving you the ability to restore any loss of data. Disaster recovery plan. is going to, let me just tell you some of the components that should be broken down into your disaster recovery plan. You should have a communication plan. So how employees are going to communicate with other employees during a disaster and with management. This should include employee contact information to allow for prompt reporting and notification. You should also have a detailed asset inventory, which contains a detailed inventory of all your computer workstations, their components, as well as scanners, tablets, phones, any of your electronic equipment. You should also have an equipment plan as part of your disaster recovery. This should describe how this equipment should be protected in the event of a disaster. So perhaps how do you keep it from, how do you move it from, to keep it from getting wet? Disaster restoration priority plan. So outline what data functionality should be restored first in the event of a disaster. And then a vendor communication and service restoration plan. I mean, obviously, you're going to need your lines of communication brought back up if you no longer have internet service or phone service. So you've got to identify your process and your plan for restoring those services as well. All right, so that's disaster recovery. We're going to restore any loss of data. The next component of a contingency plan is emergent. I'm sorry, Brent, let's go back one. Let me finish out the emergency mode operation plan. This is enabling continuation of critical business processes for protection of the security of your ePHI while you're operating in emergency mode. So, you know, in most cases, your emergency mode operations looks like, okay, we don't have power, we're gonna drop to paper. And then when power comes back up, we're gonna do this, this, and this to get this information in the system. So think about it along those lines. Testing and revision, you do have to periodically test and revise your contingency plan. How you go about that is flexible. How often you want to do that, who do you involve with doing that, but you need to document and make sure that your contingency plans are, that they work. You know, I would say the biggest failure that I see is failing to test our backup data. So without going into a lot of horror stories about where organizations have lost their data and had to restore from backup, just know that if your IT department is periodically testing that, you'll be in much better shape if you truly are in facing a disaster or an emergency. Part of your contingency plan also has to include applications and data criticality analysis. And so what you need to do is you have to know which applications are the most critical to your organization, and that helps identify which ones need to be brought up first after emergency. All right, so there's your contingency plan. And then the next one is one that I don't think anyone knows that this is that this is required, and that we get this most often confused with performing a security risk assessment. Evaluation. Evaluation is not the same as a security risk assessment. Evaluation says, and it is required, that you perform a periodic technical and non-technical evaluation that establishes the extent to which your policies and procedures meet the requirements of the HIPAA Security Rule. So in other words, how it measures your overall compliance with the HIPAA Security Rule. It tells you how you're doing with your safeguards. Do you have policies in place to address all of these safeguards that I'm going over with you? Is there some missing? So when we look at technical and non-technical, I think that's where it gets confusing, because the way it's written, it sounds like you got to do a technical evaluation and a non-technical evaluation. What it really should say is you need to do an evaluation of your technical safeguards and an evaluation of your non-technical safeguards, and then figure out how well they're measuring up and where are the gaps. So technical would be like your access controls, your identification processes, authentication, encryption. Non-technical would be those management policies and procedures that we're going over in administrative, and your physical protections, okay? So that's evaluation, and I have to say, I never really see any proof of evaluations. I see policies that describe that the organization has an evaluation process in place, but they consider their security risk assessment as their evaluation. And that's not what is meant by this part of the security rule. So get to know this a little better and make sure that you're doing some sort of an evaluation periodically. It can be once a year, it can be once every couple of years. All right. And that brings us to the last safeguard of the administrative standard, and that's business associate contracts. You have to have business associate contracts in place with your business associates. And per the HIPAA Omnibus Rule, there are 10 provisions that every business associate contract should have included, and that's been since 2013. I won't read all of these. I will tell you that this is an area where I see organizations doing really well. They have updated their business associate contracts and they do have business associate contracts in place. I think tracking of our business associate contracts could be done a little better, knowing who they are, keeping a spreadsheet or an internal management tracking system of our associates, business associates. I think we could improve on those processes, but overall, we understand this part of the rule pretty well. So now let's move into our physical safeguards. Physical has to do with our physical protections. So you've got to have a policy that addresses facility access controls. All right, and within those facility access controls and procedures, you have to have contingency operations. Didn't we already talk about a contingency plan? Yes, we did. This is where it gets kind of confusing. We're talking about contingency again. Plain and simple, contingency operations are procedures that are defined for allowing appropriate employees to access your backup information during the event of a disaster or an emergency. So somebody has to be designated to be the one that goes off-site to get those backup tapes if that's where they're stored, or, you know, I guess contacting the EHR and working with them. So contingency operations means allowing access to the facility that contains your backup information, and who is designated what role can do that. The facility security plan, you've got to safeguard your facility from unauthorized physical access, tampering, and theft. So what physical protections do you have in place? Such as cameras, is your server room locked? Do you use digital readers and keypads? So identify those in the facility security plan. Access control and validation procedures speak to controlling and validating a person's access to your facilities based on their role or their function. So let me see if I can clarify this a little bit. You want to limit your accessibility to your facilities, your workstations, your servers, and other electronic media, and you need to establish the authorized user list that ensure that only those who require will be given access. So we talk a lot about a facility user access list. So this is a list of your active employees, and these are the areas in which they are designated or given access to. And then maintenance records. When it comes to our facilities, we have to track our maintenance to our physical security controls. So you have to document the repairs and the modifications made to your physical components of the facility, which are related to security. So the way I see this being done in most cases is organizations will have a ticketing system. And so when something needs to be changed or a lock on a door needs to be changed, they will enter that in the ticketing system and you have an ongoing record of that. Okay, another physical standard is the workstation use. And well, this is actually two standards in one. I put them on one slide. You have to have physical standard policies in place for the workstation use and the workstation security. Workstation use, your policy should basically say what's the appropriate use of our equipment, of our computer workstations. I see most organizations using what's called an acceptable use form, and your employees will sign that, they read it, they acknowledge it, and it's kept in their file. That's a great way to handle that. But you do need to have a written policy surrounding that process. And then implementing physical safeguards for those workstations to restrict access. So what is your physical safeguard around that workstation? And these can be low-cost measures that you can put into place. So some examples would include having a policy that requires office doors to be locked while employees are away from their desk, or arranging your workstation so they're not visible. You could have USB port locks so that they can't transfer data from their USB port over to their computer. So all of these would be methods in which you could physically secure your workstation. All right. Physical standard device and media controls is next. So our device and media controls, let's clarify this. You have to have a policy that says you're going to govern the receipt and the removal of hardware and electronic media that contain ePHI into and out of the facility, and the movement. All right. So when we break that policy down, we're going to have a section for disposal. When we are done with the computer, the hard drive in it potentially contains ePHI. So we have to destroy that hard drive. And so that's what's meant by disposal. How do you destroy it? Most organizations will partner with a third party for destruction services, and in return, you should get a certificate of destruction, a receipt showing what was destroyed and when it was destroyed and how it was destroyed, and you maintain those with your records. Your media reuse speaks to how you sanitize your workstation. So how do you remove ePHI from a workstation or a laptop before you designate it to a new employee? So maybe that is you reformat your hard drives. So in your policy, describe your procedures for how your organization will reuse media and make sure that no one is coming across ePHI on that device. Accountability is maintaining a record of moving your hardware from one facility to another or one location to another. So this is addressable. You can use spreadsheet, you can use an internal tracking system. You just need to address this in your policy that you are maintaining records of movements of hardware. And then data backup and storage. So this sounds redundant again. We've already addressed in our contingency plan that we're going to do data backup and address where we're storing it. But as part of your device and media controls, it says that you must back up data on a device before you move it from one location to another. So these procedures here are not speaking directly to how you back up your data on a daily basis for your EHR system. This is if I'm moving a device or I'm reassigning a device that could potentially have ePHI on it, I need to back up that data before I sanitize that device and move it off, okay? Now that's all of the physical standards, and we're gonna finish up with the technical standards, and that's gonna be access controls. Okay, so again, think about these in terms of technical safeguard standards. So your access controls, you have to have a policy that includes how you assign unique user identification. So everyone in your organization should have a unique user ID. You should have emergency access procedure. So how do you obtain ePHI during an emergency? This sounds redundant too, but think about this in the context of a break the glass policy. So if you had to designate access to your ePHI for, say, a member, someone that does not work for your workforce, a physician is coming in to assist during an emergency, what's your procedure for granting access to him? So you need to have that policy. It's required. Emergency access procedure for your ePHI. Automatic log off, this is addressable, but it's part of the safeguard requirements. It says you know, what are you doing to ensure that you have electronic procedures that terminate an electronic session after a predetermined period of time? So implement those automatic log off procedures, especially with your EHR. And encryption and decryption. So this part of encryption under access controls says you've got to have procedures to describe a mechanism to encrypt and decrypt ePHI. So think about this encryption as encryption for data at rest, because another technical safeguard identifies encryption when we're talking about transmitting data. So encrypting your data at rest. Do you encrypt your laptops? Do you encrypt your PC workstations? Write out your process for doing that in your access controls policy. The next technical safeguard is audit controls. So if you remember at the beginning of the presentation, you had what was called information system activity review. That describes your process, your timing for reviewing access logs and audit logs, but your audit controls identify the actual hardware or software or procedures that record and examine the activity in your information systems, okay? So things like your EHR will have a built-in audit capability. You should familiarize yourself with that. So you can run audit logs in your EHR based on user, based on patient. You're going to have audit capabilities through your server logs, event logs, Wi-Fi logs. Help get IT to help with this policy and identify all of the capabilities you have for auditing. And those are the controls that you're going to use for information system activity review. Data integrity is another technical safeguard. So let's make this simple. This is one that's kind of hard to understand what you're supposed to be doing. You've got to have mechanisms that corroborate that your ePHI hasn't been altered or destroyed. So as part of that policy, you're going to write what's your mechanism to authenticate electronic ePHI. And so it can be compromised by both technical and non-technical sources. Workforce members may make accidental or even intentional changes that improperly alter or destroy your ePHI. So the purpose of this standard is to establish and implement policies and procedures for protecting it from being altered or destroyed. When I look at this and when I assess this, I know that most EHRs, well, basically all of them have digital signatures. So when you're saving and signing a chart, it is digitally signed, and most EHRs won't allow you to go back and alter that chart. So, you know, that's something you can identify in this data integrity as a control that is in place for ensuring that ePHI has not been altered or destroyed. Person or entity authentication. This is easy. Basically, you know, when these security rules were first written, and this is on the next slide, we didn't have all of the wonderful technology in place today and easy to use technology back in 2005 that we have today. So simply put, person or entity authentication is basically having passwords, the use of passwords on your systems. And I want to share on the next slide the NIST standards for passwords because they've been updated, and these might shock you, but I'll go quickly. NIST is the National Institute of Standards and Technology, and it's a federal agency that promotes U.S. innovation and industry by advancing technology and information security, but the U.S. government requires all of its agencies to follow these guidelines. The guidelines say for the best password practices, we should increase our password length to be a minimum of 8 characters. We should allow special characters and spaces, even emojis. I didn't even know that. We should permit users to paste text. So if you're using an app that is a password manager, this is meant that you can copy and paste that password from your security or your password manager into your system. So they say that's okay. And then outlaw password hints, because password hints, they say, are an example that can actually undermine your password security. It's too common for users to set hints that make it very easy to determine the password. So we shouldn't use them. And they have outlawed them on all US government agency systems. And then reduce the complexity. This is one you're going to love. So NIST says that you should minimize the complexity requirements, like the use of uppercase or letters, symbols, numbers, because this can result in passwords that decrease usability and hamper the efficiency. So that's actually good, but what you should do is have a much longer password, much longer than 8 characters. And then even more so, the periodic password change requirements. NIST says that it's really counterproductive to require a workforce to change their password every 90 days. So consider making it longer, but making them have more, password phrases, for instance, and longer passwords in place of that. And then screen passwords. So make sure you're utilizing software that can check proposed passwords against previously used. And a lot of EHRs will do that. You can't use the same password as the last 3. Okay, next slide. Transmission security. This has to do with making sure that ePHI has not been improperly modified during transmission. And in this policy, you should address integrity controls and encryption. Okay, integrity controls, we've talked about data integrity earlier. Okay, that's making sure that it hasn't been altered or destroyed while it's in our possession. But when we transmit it, we have to make sure that it's not being altered or destroyed and that it ends up going to where it needs to go. So you've got to have protocols in place, and HTTPS protocol is the most commonly used for that. So you're pretty good in that, but you do have to write that you do have integrity controls in place. Encryption is encryption for when you're transmitting. So if you're transmitting ePHI through email, for instance, you've got to have a way to encrypt that email. All right. So that covers all of the HIPAA safeguards, and boy, did I go through those quickly. I don't expect you to be an expert, but let's look at this next slide, Brent, and just look at all of the controls that we just covered. Okay, guys, we have to have policies in place that address all of these. This encapsulates everything that we just talked about. So go back and assess and make sure that your policies have these standards and these implementation specifications addressed in some form or another. And on the next slide, my very last slide, I just want to reiterate the importance of having a security management team to help you with this process. One person alone can't do it. You need to pull resources from IT, from compliance, from HR, and you should make sure that that team helps you with those policies and procedures and implementing those specifications, making sure that your policies have all of the standards identified. Make sure that you're doing your annual security risk assessment and utilize that team as part of that process. And then as an outcome of that security risk assessment, you have to do ongoing mitigation and risk management strategy. It's a never-ending process. It's not a one-time and we're done. And I say that in every presentation. So thank you for letting me go over the entire HIPAA security rule. And I did go over. I think that probably doesn't come as a surprise to my colleagues, but I'm going to pass it back over to Catherine.
Thank you so much, Amy. And it was fine to go over. That was really important information to share with our webinar participants.